I think education is what's really needed about this condition. And so somehow getting information out to other medical providers. And I do hope that this film helps with that mission. I am working on a book right now called Taming the Zebra. It's much more than hypermobility, because it's the whole body that's affected. And we do need, as practitioners, to take a more holistic approach in looking at organ function, immune function, the function of the joints, but the mind as well, and how the mental health is affected. We need to take a biopsychosocial approach to care for these patients in order to be effective. It does take more energy and effort, and intelligence on the part of the treating therapist or provider. It takes more resources. It takes a team approach. So having social work support involved in connecting the different providers and better communication between the providers is really needed. I do hope that our book is a resource for both patients and for providers, where you can flip to the autonomic nervous system section and get some tips for what to do with your patient, or flip to the gut section and have an idea of what could be going on and what type of practitioner to refer the patient to for gut health, because that is going to impact physical therapy. If the patient's not absorbing nutrients, it's going to be really hard to have the energy to do therapy and to build muscle mass, which is needed to improve the stability of the joints. Here at our office, we really try to take a holistic approach. We take a biopsychosocial approach to care. We might on one day be working on mind-body technique to calm the autonomic nervous system and improve the balance of parasympathetic activity and sympathetic nervous system activity. We might be working on a manual adjustment to a joint, or we might be working on an exercise that's going to help just support and stabilize the joint. Or maybe we're going to be doing a screen of inflammatory triggers and helping the patient to recognize their own inflammatory triggers. It's such a broad range of things that we do in the office here. I can understand why it's hard to find more therapists that are specialized, because it really takes knowledge and a broad base of information in order to effectively treat this patient population. So if someone wants to stay focused on the orthopedic side of things, then really having a team approach is important, and having other people to refer to, either in or outside of the practice, to support the mental health component, the immune system component, the gut, the nervous system, and then the joints themselves.